Good morning, ladies and gentlemen. Welcome to today's Seniors, Dear Administrator, and Bayshore Guest Home and Gardens. It's a pleasure today to have Virginia Ginny Carnahan with the Dattoli Cancer Center.
Thank you.
And also the Dattoli Foundation. I have several friends who have been to Dattoli, and the reason I did want to do this interview with you is because I've seen a difference, and I see that they have retained their quality of life. Could you tell me a little bit more about this?
About prostate cancer and what we do that is different from other treatments. Yes, I'm happy to do that. Prostate cancer is still a very mysterious cancer. We know a lot more than we used to know, but we don't know everything. We do know that the location of the prostate makes it difficult to treat. It's buried deep in the abdomen, surrounded by very important functions and structures. In fact, the urethra runs right through the middle of the gland. Yes. So surgical removal of the tumor or the gland, the old style medicine, often left the gentleman with problems for the rest of his life, having to do with being able to retain and release urine. Sexual function was often interrupted or totally dismissed. And for men that are in the prime of their life, thinking about their future with those quality of life issues is pretty devastating. Dr. Dattoli, who is a radiation oncologist, in his medical school days was fascinated by the fact that many cancers had great progress in treating them, but prostate cancer was still very barbaric in the way it was treated. And he took it upon himself to try to find a better way for men. It's important to understand that more men are diagnosed with prostate cancer every year than women are with breast cancer.
I did not know that.
Many people don't realize that. Women have coalesced and come together and become very vocal and very assertive about their disease. And this is the month of October, which is Breast Cancer Awareness Month, and the pink ribbons are everywhere. Men have a little bit different perspective on their health, especially anything that has to do with their sexual function. They're reluctant to talk about it, even with their family members. And so very often they are suffering in silence. I wear a blue ribbon, which is the emblem for prostate cancer awareness, and part of what I try to do every day is raise awareness and help men understand how important it is for them to be screened and checked and talk with their doctors, talk with their friends, understand what someone else has gone through, and don't be afraid. Don't put your head in the sand. What we say is man up, do the right thing, protect yourself for your family and for your friends and for the rest of your life. The PSA is a very simple blood test, and it has been around for about 20 years. And in that period of time, prostate cancer deaths have been reduced by 40%. It's interesting to note at this particular time, a panel from the federal government is now recommending that PSA tests be eliminated for great portions of the male population.
Well, what can we do? Because part of the column and part of what we're trying to do at Bayshore and Dear Administrator is to be proactive in educating and rallying people to support and help the lives of seniors, especially that generation that gave us so much. So what is it that we can do to curtail them from doing that?
Well, the federal government has a panel that is accepting through the end of October personal letters.
Okay.
If anyone who has known someone who has had prostate cancer, has had it successfully treated, and has gone on to live a happy, healthy life, should stand up and say, that PSA test was valuable to me, and it should be kept as an option for men that want to have it. You can't force it on people, but it should be available for those who select to do that test.
Well, could you send me the link?
Yes.
So that on the Dear Administrator, as well as on the Bayshore Guest Home and Gardens, we can put the link up and they can do an email, I believe now.
An email?
Everything
Sure.
can be done.
I can certainly do that for you.
Is there a cut-off stage where the seeding is, where you would not do that? Or?
Well, let me tell you a little bit about the protocol that Dr. Dattoli and his partner Dr. Sarais have come up with. It has produced the longest published cure rate in medical literature. We have statistics looking at men 16 years after they were treated, and 83% of them are still cancer-free, which is a huge number. That doesn't mean that you're only going to live 16 years. It just means that that's as far back as we've had the statistics to look at. What Dr. Dattoli and Dr. Sarais do is they take the understood maximum amount of radiation that is required to kill prostate cancer cells. There's different radiation levels for different types of cancers. And they treat the man, about half of that amount of radiation is through daily, what we call dynamic adaptive radiotherapy. The gentleman comes in every day for about a 10-minute process of having radiation administered in a specific pattern in his abdomen. Then we do radioactive seed implants, and the seeds make up the other half of the bulk of the radiation. By using the two different kinds, we're able to reduce the risk of the side effects, which is impotence or incontinence or both, and get a really good cure rate. There are some places that do just the daily radiation. They do twice as much as we do. There are some places that just do the seed implants, and they do twice as many seeds as we do. Now, you ask about age. We have treated men up until their 90s. It depends on the health of the individual and the vitality. You know, I have met 85-year-old men that have more energy than I have. I've also met 50-year-old men who've decided that's the end of their lives. And it's all a very individual decision and an individual plan. But there certainly is no upper age limit. What we do is not surgery. So the man is not put under general anesthesia, doesn't have that risk of infection following surgery. The biggest problem with any kind of surgical procedure with an older person is the anesthesia.
Correct.
And so whenever you can have a procedure that does not have anesthesia, that's a benefit for you.
And with your foundation, how can we help?
The foundation raises funds. The funds allow us to publish a number of books and brochures, and I've brought some to you for your library.
Thank you.
Our foundation also does free screenings twice a year for individuals that don't have insurance and that are concerned about their prostate health. Twice a year we offer absolutely free, no strings attached screenings. And then the Dr. Dattoli's research is also supported by donations to our foundation.
Ginny, it was wonderful. Monica Dowan, the owner of Bayshore Guest Home and Gardens, would like to make a contribution. We can get into that after the interview.
Okay, that's lovely.
But thank you very much.
Oh, you're quite
I
welcome.
really appreciate it, and if you could send me those links, let's
I will do that.
raise the awareness.
Absolutely. And anybody that has questions that of a personal or particular nature, they want to call me, I'd be happy to answer them and help them understand what they're going
Good.
through.
And if you do have people who come from out of town and
Mhm.
want to have a place to stay with nursing help, they're welcome to stay here in respite sort of
Wonderful.
situation,
Yes.
not as resident.
Yeah, thank you.
Okay?
If you'd like information on prostate cancer, you're welcome to call me, 941-365-5599. Or you can look on our website, www.dattoli.com.
Ginny, thank you. Ladies and gentlemen, on behalf of Bayshore Guest Home and Gardens, dear administrator and today's seniors, I thank you for watching this interview, and I thank the readers for helping us with all the feedback we're getting. And please let us make sure that we contact the government. The link will be on the Bayshore website as well as the Dattoli. And let's make sure that prostate screening comes to the forefront because it is extremely important. And let's all make sure that we all help our seniors and our younger generation. Thank you, ladies and gentlemen.